Well, three senators are proposing legislation to give Americans $2,000 a month during and in the aftermath of the coronavirus pandemic. The proposal comes from California's Kamala Harris, Vermont's Bernie Sanders, and Massachusetts' Ed Markey. Well, the bill would give payments to individuals making up to $100,000 a year, with smaller payments to those making up to $120,000. On top of that, a $2,000 monthly payment will be delivered per child for up to 3 kids. If this is passed, the legislation would be retroactive back to March, when a one-time check was given to many Americans. Well, joining me now, Congressman Joe Kennedy, who represents Massachusetts' 4th District. Thank you, Congressman, very much. He joins me now from Newtown, Massachusetts. You know, your state actually has the 3rd highest rate of cases of infection in the U.S., and particularly the hardest hit are Latinos in Boston. Governor Charlie Baker's stay-at-home orders are going to expire May 18th. Do you believe your state is ready to reopen businesses?
I think it's critically important that every state follow the science and follow the conditions on the ground. And so what we've seen here in Massachusetts and in parts of Boston anyway, is that we are starting to see a decrease of that curve of infection. But Rena, make no mistake, for the town-by-town analysis or data that came out on Wednesday, Chelsea, which is just east of Boston, has an infection rate of about 6 times that of the state average. I was in Chelsea delivering meals on Tuesday. I have never seen as long a food line in my entire life, and I have lived in multiple countries in the developing world. It's been devastating for lower income communities, for lower income families, for immigrant families as well. Just as your prior segment said, that the disproportionate impact of the virus is being felt on lower wage workers and lower income and net worth Americans. It's having a devastating impact on their health, and that's where our aid and our resources need to be focused to get out of this as quickly as we can.
And Congressman, in particular, you and Washington Congresswoman Pramila Jayapal are introducing a Medicare Crisis Program Act. It's going to try to guarantee health care access during the pandemic. How do you plan on convincing Republicans to get on board with this?
Because if there's a central lesson from this moment, Rena, it's that your health and my health are linked. That's why people are going out wearing masks, right? It's to protect somebody else from you infecting somebody else and somebody else from infecting you. The whole point on this is that you have to, if we're going to get through this, we have to stop the spread. And you don't stop the spread if you are intentionally leaving millions of Americans out of healthcare coverage. And so what our bill does is say, if you've lost your job, then we're going to enroll you in Medicare. And we're going to have a dramatic expansion of Medicaid. Because remember one other thing with all those jobless numbers that we just heard, for those folks that had employer-sponsored healthcare, that healthcare might be gone. And for those folks that are then going to try to use COBRA instead to cover it, COBRA is extremely expensive. And so the disconnect here isn't just financial, it hits your health. And if it's hitting people's health and they're not going to be able to get access to the care that they need, this virus is going to continue to spread. So Pramila and I, Congresswoman Jayapal and I, put together a bill to try to say, at the very least, let's stop that and let's move forward.
You know, I mentioned earlier your Democratic opponent, Ed Markey, Senator Markey, who's teaming up with Senator Kamala Harris on a monthly income boost for lower income Americans. We've seen the monthly jobs numbers from today. What would be your plan to help working families who are really hit the hardest by COVID-19?
So, Rena, it's a great question. I came out with a very similar plan months ago, back in early March. Said that for any individual making less than $100,000 a year, you should get $4,000 and $2,000 per child. Which, if you're a family of 4, and again you and your spouse combined making under $200,000, you would have gotten $12,000. Under the plan that the Senate designed, they got $1,200 per person, and some of which those checks haven't even arrived for folks yet. So the insight here is that if you are going to try to ask the American public to stay home and focus on their health and not infect other people, you need to be able to give them the financial ability to actually withstand that time where they're not going to get a paycheck. The $1,200 that the Senate came up with is grossly inadequate for families across Massachusetts. I've done town halls in every corner of this state. The average Social Security payout is about $1,200. I've asked thousands of people, how many people could live in Massachusetts on $1,200? Not a single hand has ever gone up. We need more, which is why, again, months ago, I proposed more. And I think that's exactly the type of response Congress needs to pass to support the American public.
You mentioned the town halls you're doing. I want to ask you also about the election. There's a new Emerson College poll, which actually shows you up 16 points among likely voters with a face-off with Markey. The Boston Globe reports you launched a $1.2 million TV campaign ad. Many progressives, some veteran Massachusetts Democrats, have lined up to endorse Markey over you. If you win, is it worth upsetting the Democratic Party during the midst of a pandemic like this?
So, look, I think what this pandemic has shown is the need for stronger leadership in government and stronger leadership in the U.S. Senate. And that's why I got in this race. If I thought that almost a year ago, I think that even more now. Look, the fights that we are going to be up against to actually ensure that every single person in this country gets access to health care that they need when they need it, to ensure that lower wage workers, essential workers, the folks that we are now praising for keeping our society moving, that we treat them as essential. We don't just say that they're essential. That we make sure that they get a living wage, that they have access to health care, that they aren't codified as independent contractors and have their status of quality of life and financial status steadily eroded over years. That we actually make good on this promise of meaningful environmental justice action, which is why I'm honored to have worked with one of the great champions of this in Congress, Chairman Grijalva, to put forth one of the most aggressive environmental justice bills in modern congressional history. That's what this moment is going to need, and that's the type of leadership I'd like to be able to bring to the Senate.
You know, the other senator from Massachusetts, Elizabeth Warren, whom you endorsed, is in the running to be Joe Biden's vice presidential pick. Let's say she does get the VP job. Do you think that would be problematic for Democrats looking to reclaim the Senate, since it'll be up to the governor of Massachusetts, a Republican, who has the power to appoint a member of his own party?
Look, first off, I am a huge supporter of Senator Warren. She was my law professor many moons ago. I was thrilled to support her in every race that she's had, and thrilled to endorse her for the presidency on day one of her race. And I have no doubt she would serve our country extremely well as a vice president. She's going to be great at whatever she does. And I think what she brings to that office, or would bring to that office, is well worth the fight that we would have to ensure that a Massachusetts Senate seat here, given a Biden administration, is going to stay.
You know, everyone's so worried about securing the November elections. I want to ask you, I know you're working with Massachusetts Attorney General Markey to push for universal vote by mail in November. Tufts estimate that this would cost somewhere between $12 to $30 million. Is protecting the election putting too much pressure on cash-strapped states?
Not at all. Congress has just authorized over $3 trillion of money. We're talking about a perhaps multi-trillion-dollar package in this next round. I don't know, Rena, how much we would say is our price tag on our democracy, but I think it's worth at least $12 million for an election. And the fact is that people, I think when you think this through, flip that around for a second. If we do not ensure a robust vote by mail option for voters in Massachusetts and every state, we're doing this in the midst of a pandemic. So what if 10 days out from the election, you get sick or your spouse gets sick? All of a sudden, you can't go vote. And are we really going to say that we're willing to put the hands of this election in only for the folks that don't get sick, don't have a loved one that gets sick, or those folks that are willing to risk their health to go vote? We learned those lessons in Wisconsin. We've seen over 50 people actually contract the coronavirus from going out to try to exercise their vote on that day. We saw polling lines go stretch down the block and around the corner because Milwaukee couldn't find enough staff and volunteers to actually man those polling locations, so they went from 180 different polling locations to 5. We don't have to do that in Massachusetts, and we don't have to do that as a country. And so as we're actually trying to invest to protect our people, I think we can make the relatively small investment that's necessary to protect our democracy. And I think not doing so is reckless and risks a altered election, whichever side you believe in. It does not, in fact, invest in our process and does not invest in our democracy.
Congressman Joe Kennedy, we're going to have to leave it there. I want to thank you so much for joining us here on CBSN.
Rita, thank you. Take care. You're welcome.